What I'm going to focus on is on the Interagency Child Protection Information Management System. I'm just going to give a very brief background and just refresh everybody's kind of memory on what the CPIMS is and how it works, and then look at what are some of the features that we'll be looking at in 2012, and finally, the second half of my presentation really focuses on the training for the CPIMS. What are some of the things that we've seen that we really need to focus on when training on the CPIMS? What are some of the things we need to ensure we address as part of a training on the Child Protection Information Management System, and what an outline of a training should be and who it should be addressed to at the field level. And I'm hoping to get from you also any inputs that you have on your experience of communications with the field on when discussing the CPIMS, which would be great, and we can use to refine with the trainings that we provide. If I'm not clear at any time, if I'm talking either too fast or if I'm not clear, please just interrupt me and let me know. Otherwise, I'll ask if the presentation is out of sync. So just quickly, the Interagency Information Management System is a system which facilitates case management and data analysis for children. The objectives are to promote compatibility across child protection programs, improve timeliness of response, invest in one standard tool which can be used by multiple child protection actors in various countries, and facilitate the effective and safe use of information to protect children on a large scale. The CPIMS has three main components: a standard set of forms, which can further be customized at the local level, a database which itself can also be customized in line with the forms at the local level, and then data protection and information sharing protocols, which can again be customized at the country level depending on organizations that are involved and the type of information that's collected. As I mentioned, each country or agency is responsible for collecting, entering, and managing their own child protection information management system. We don't have access to any country-level data that's collected, and they have administrative rights to customize the forms and database to their specific needs. And the information that they collect can be encrypted, and partial data can be shared across agencies for transfers, referrals, and reporting. So I'm now on the slide entitled Case Management. Is everybody with me?
Yep. Yep.
Okay, great. I hear no no's, so I'll just continue. So the CPIMS has been designed to support case management. So it stores detailed information on children in separate case files and organizes the children's information in a coherent and accessible way, reminding caseworkers of tasks that are due or overdue. It indicates the status and progress of each child's case, so allowing caseworkers to identify children that are most vulnerable and ensuring that that specific actions are prioritized for follow-up. And it allows social workers to transfer electronic cases out to other organizations and receive electronic cases in from other organizations for referrals as needed. It also is specifically designed to support family tracing reunification programs, so it records children who are unaccompanied or separated, as well as children who are reported missing, and facilitates the instantaneous matching of records between within the database or between like databases to allow for a speedier identification of missing children or separated children. And it informs, as part of the case management process, it informs child protection workers of children's cases that are pending successful FTR. So regarding the customization, the database administrators at the country level have complete flexibility, discretion, and autonomy to design the database to meet their own specific needs. They don't need to adhere to any prescribed data sets, so they can edit, delete, or add forms to be included as part of the caseload. Within the forms, they can review questions that should be included, decide or define which question is mandatory and which ones are not, the order of the questions, etc., and the language that the database operator will use. Currently, from the global level, we have English and French available, and we're working on the Spanish and Arabic versions. But countries are also able to translate the database into all their own local languages as necessary for national staff to use. Users can use the CP IMS in emergency, development, across the continuum of care in both types of settings. And it really facilitates, in this way, collaboration among partners that are using the database in the field, as it brings agencies and partners together to decide what data will be collected, and reflects, it doesn't reflect the template of one specific agency, but really brings the agencies together at the country level to define what data is going to be collected. There are specific measures for data protection and security. So there are different levels of user permission and access to the database.
The conference call.
Each user has a specific password and login and password access, and they have different rights as determined by the database administrator in each country. And they can encrypt a child record to allow for electronic transfer. The database stores specific data protection requirements for each child. So one child may allow their information, give consent for their information to be shared with specific partners. Another child may not want any of their information shared. And when a user goes to export this information, there are safeguard measures, so flags or warnings, to ensure that the user is aware that the child has or has not given consent for information to be shared. And finally, the program can be used for data analysis, which is used to inform, again, the program design, strategy, or resource allocation. And these can be customized at the local level. So generating reports and graphs according to the data
the conference call.
That's on the database, and this is these graphs and tables are automatically updated as new data is entered onto the database. It's possible to generate lists of partial or complete information, and it's also possible to export reports in Excel format, which can be shared with partners that may not be using the same system within the country. I just want to give two examples of how the CP IMS has been used, specifically how the data that's collected has fed back into the programs. And one example is from Sri Lanka, where they use a CP IMS for case management of children associated with the armed forces and armed groups. And as part of the registration forms that were collected, part of the information that was collected by the social workers was the amount of time in months that the children were with the specific armed forces or armed groups. And what came out of the analysis of this data that was collected was that actually the vast majority of the children, over 80% of the children, had actually only been in the armed forces for less than a month. And so this data was actually used to review the way the program was designed, the type of psychosocial support that was provided to these children. And it was also used to advocate for the release of more children with the local armed groups. In Ethiopia, in Ethiopia, the CP IMS is used for case management of vulnerable children in a camp setting. And there's a specific, one of the case studies we have is of a girl who was registered on the database and supported for a few years, and then her case was closed. And several years later, the social workers were aware that her family was planning to marry the girl to an older man. And so they went back into the database, opened up her file again, and looked up the information that they had on the file, and they were able to use the information from the CP IMS to corroborate that the girl was actually underage, according to the legal marrying age in Ethiopia, and were able to use this information to advocate and discuss with the family and protect the girl against the marriage, and the marriage was actually cancelled. So these are just two types of scenarios where the information, aside from the case management process, but where the information can also be used beyond just the just the day-to-day running of the case management program. So I'm now on the slide entitled New Features. Is everybody with me?
Yep. Yep.
So some of the new features that we developed in 2011 included a list of overdue tasks. So children who should have received follow-up visits or whose information has not been completed and needs to be completed on the database. And this comes up as soon as the user logged into their database, and can also be referenced once they're logged in afterwards as well. We've added a new feature which allows for a customizable phonetic search of children's names on the database. There are two ways of using this. You can either actually search for children within the database against a list of names which a country has themselves customized according to the different spellings that may be used in a country, but which all ultimately are the same name. And this can, the aim of this is to reduce double counting, but also to ensure that it speeds up the identification of children within the database from an FTR point of view as well. Individual children can have specific timescale targets for their own needs, so and these can be customized to the individual child. There is a better synchronization between the different languages. So, for example, if two countries, just as an example, if in Liberia and Cote d'Ivoire they decide to use, they agree on the same forms that will be used and have the same CP IMS that's used across the two countries. If a child is registered in Liberia and then returns to Cote d'Ivoire, the Liberia CP IMS database administrator can send the file across to Cote d'Ivoire, and Cote d'Ivoire simply needs to change the language, and all the form, including all the responses on the form, aside from the lengthy text narrative, will be automatically translated between the English and the French once the language has been customized. So this is a new feature which we've included this year to try to promote the use of the cross-border use of for FTR purposes specifically. And we've increased the ability to encrypt specific sensitive information when exporting case files from the database. So what are some of the activities that we're looking at going forward? One thing that we'd really like to focus on is on a TOT for global level staff, so that, for example, the rapid response team of the CPWG, emergency response personnel specifically providing support on to child protection in emergencies and specifically on emergency response. And we're currently finalizing a TOT manual and hoping to roll out this training sometime in 2012. And we're also looking at the compatibility with other IMSs. What we're really looking at the moment is the programmatic needs for this compatibility. So what are the reasons from a programmatic level for the CP IMS communicating, sharing information electronically with the GBV IMS, with Progress 4 from UNHCR, with the MRM IMS that's being developed, and with the Rapid FTR. From an Excel point of view, we're looking at increasing the ability of the CP IMS to import data from Excel, which at the moment it's not as easy as it can be. So we're looking at how we can improve that. We're also aiming to move the CP IMS to a web-based system, and with that try to improve the confidentiality aspect of the case files that are included on the CP IMS by restricting the viewing of certain case file information from the users. So looking at the training on the CP IMS, what we've seen in a lot of cases and in a lot of countries that we've supported, both in country and remotely, is that a lot of countries decide that they need to use a CP IMS and start discussing the CP IMS immediately without having really defined what is the child protection program that they're going to be using the CP IMS to support, and without really discussing what the CP IMS is going to do for the program itself. So what we've really tried to kind of bring back into the discussion on training on the CPIMS is a need to define, before discussions on the database really start, but define if there are going to be multiple organizations using the CPIMS, define what the role of the lead agency is going to be and what the coordination between the lead agencies and all the other agencies on the ground are going to be. And the coordination includes defining how information will be shared, when it will be shared, what information will be shared, developing standard operating procedures and information sharing protocols between the agencies if possible, and then defining what the purpose of the CPIMS will be for the country program, for the CP country program. So what the case management program is going to be, and therefore what the CPIMS, what purpose the CPIMS is going to serve for that case management program. And this includes, for example, defining how the CPIMS will be used, so defining what forms are going to be used, what questions are going to be collected, and what information is going to be collected, and what the data analysis of that information is going to be. So what information will the agencies, the specific agency using the CPIMS, need to get from the CPIMS. So and that will define, therefore, what information is going to be collected. So what they'll use the information for from a data analysis point of view, as well as a case management point of view. And really, while that may not be the biggest part of the training, that really needs to be defined before any training takes place on the database and on the customization of the database, which is really the last part of the training. And what we have seen is that in a lot of cases, we've supported countries who are still defining what the case management program is going to be. They're still kind of defining what the services are going to be out there and what are going to be the steps that they're going to take as part of their program. And really, these need to be these are all aspects which need to be defined as part of a CPIMS training, but before any training on the database or any training on the customization takes place. And another thing that we've seen that needs to be addressed is really ensuring that child protection staff, so managers and officers, as well as database staff, are part of the training. There have been a lot of cases where child protection managers feel that the training on the CPIMS is only belongs to the IT staff, the database administrator and the data entry clerks. And really, unless they have a sound understanding of what the CPIMS is and how it will support the child protection program, the two things are going to be completely separate, and they're not going to take advantage of how the CPIMS can inform their child protection program and really use it to design the program, to feed back into the program, and to ensure that the children that the case management program is supporting really benefit the most from having invested in such a system to support the program. So ensuring that there is also constant communication between the child protection managers and the database staff as more and more information is entered onto the database, to ensure that the data analysis, for example, is done in a way that the child protection managers are able to use that information to advocate with, whether it's the government, whether it's with donors, or whether it's back into discussions with the community and with the caregivers of the children. So really using this information to improve how the child protection program is running on the ground. And there's a real need to make sure that that communication is there between those two staff. So a training outline that we've defined for the CPIMS would really look at briefly just the background on the CPIMS, and then a discussion with the team on determining whether the CPIMS is really necessary, what it's going to do for the program, and how it's going to support it, and then setting up the CPIMS. Before talking about the database, setting up the CPIMS, looking at the coordination and looking at the case management and the customization of the case management forms, the defining the different steps of the case management process, and the referrals between agencies if there are more than one agency working on the ground, etc. And then looking at the database and explaining to users how the database works and how it can be customized. And finally, it's important to also discuss the ethical guidelines, so looking at the confidentiality, ensuring that children are give informed consent on sharing or not their information, and that the best interests of the child are taken into consideration as part of confidentiality and as part of the information that's contained within the database, that they're fully aware of how the information will be collected, how it will be stored, and how it will be used. And so this is my presentation. My next slide is just any questions. And what I'd really like to hear from you is if you have any questions on what I've said, but also if you have any experience of having talked to the field about using the CP IMS, what are some of the things that you've seen that need to be addressed in a training or that need to be addressed as part of ongoing communication with the field that we should include, for example, in the TOT with global level staff, or that you feel should be included also as part of a country level training. And also if you have any questions.
Okay, maybe I could jump in, Annalisa.
Yeah.
Joanna here. I just wanted to ask, what are, many of the people who are on the line are doing trainings within their agencies. Some of them are independent consultants who do training, and that's often, sometimes it's specific one agency, but often it's interagency, sometimes at a country level, sometimes at a regional level. And I was just wondering if there's no standalone module that we have in the basic training package on the CP IMS. And in fact, I mean, it could fall under separated children. Obviously, that's a time when the topic does come up. It could also fall under information management, because there's sometimes a module that deals with that, especially if it's a coordination training. But I'm wondering if there's just maybe two key messages that you would want to get across to people. And I guess one of them would be that people are aware that it exists. But are there kind of 2 or 3 key messages that you would say you'd want these trainers to get across and that maybe would entice people or pique their interest so they wanted to learn more and they understood what this is all about?
I guess, yes. I mean, I think the reason there isn't a specific module on the CP IMS is because the CP IMS supports a child protection program that's on the ground, but it requires a kind of, in order to actually use it, you require a full-blown training of 5 days in order to really understand how it works. And I think that's the reason why it's not, it's not a part, it's not necessarily part of the module. But I think yeah, I mean, I think the key message really to kind of take to users is, that it is available, that it is there to really facilitate and support case management of children, that it does require a lot of investment at the beginning, in time, in resources, both financial resources and human resources. So, when considering whether to use a CP IMS, there are quite a few steps that need to be taken, and quite a few questions, I guess, that need to be answered to decide whether the CP IMS is the correct tool to use for the program. I think maybe the other thing to think about is that the CP IMS is not just the database, and I think that's what a lot of people often confuse. And so it is the set of forms initially, and it is information sharing protocols as well. And I think maybe a key message would be that it would be good to think about using the CP IMS even for example, a small caseload, but having being able to bring agencies together to define a common registration form and specific tools that will be used as part of the emergency response and the case management, agreeing on how information will be shared and how the data that's collected, whether it's on paper forms or whether it's ultimately on a database, will be protected and stored. And that also in itself is part of the CP IMS. And we are there to provide that support, but that would be part of a CP IMS that's being implemented. The fact that it then has a database as an additional component because of the large caseload, because of the or for example because of the multiple locations where the children may be moving to, or that need to share information between various geographic areas, and therefore the need to have an electronic database would be justified. But I think those may be some of the messages that we would want to get across, to ensure that people really understand, what it's there for, but what they're also, the amount of investment that they need to make, the thinking process behind whether the CP IMS will be useful or not to their program and how it could be used.
I could just add in one, the first thing you said was that it exists, that, message that it's, get out there, that it exists. I would also just add as a subset of that, the CP IMS, I believe, is the longest standing interagency child protection project that we have in our sector. It dates now, how many years, Annalisa?
We started in 2004, so it's
2004.
8 years, yeah. Yes, and it's interagency, so it's been tried, it's been tested, it's been modified, it's been and we're constantly modifying it. Our reviews are in line with what the users say. We're finding this difficult, this doesn't work for me, I want the CP IMS to be doing this for me, and it's not doing that. And that's how we do kind of like reviews of the system to try to constantly improve it. So yes, I mean it is. It has been modified a lot since it began as well. It hasn't just stayed as it was.
One question I have.
Yeah.
I mean, it's a question and a comment as well, but it's more about the good time to do a training about that. I've seen so far lots of databases which were not that one, which were not really adapted to the real need of child protection. Or sometimes people will want something but who don't know what they really want. And I'm wondering about the good time to do a training. I think solutions about what kind of information would be in an information management system has to be decided before the training. But maybe you have other experiences. I mean, for me, it should be decided before the training, and then you train people on what has been agreed upon. But maybe the training is also the way to think together about what should be inside. I feel sometimes training time is too short to do that. So I don't know what your experience so far about that.
No, I'd absolutely agree with you. I think there's no point in doing a training on the CP IMS unless you know what information you're going to need, what the case management program is going to be, what the child protection program itself is going to be, and why it might need the CP IMS. And I think those things would need to be defined. I mean, in some ways, I think it may be, I don't think necessarily I would call it a training, but I think, bringing all the organizations that are going to be focusing on this together to discuss what the program is going to be, what it's going to look like, what information will need to be collected, defining the form that will be used. These are all kind of basically steps towards then the training on the CP IMS. And some of them are part of, some of them can be part of the training, but I think a lot of the design, let's say, of the program needs to be done before any training on the CPIMS. I would absolutely agree. And I think there is maybe what would be good is to, and the reason why we're looking to do the TOT at the global level and really have people who do go out to support an initial emergency response in the first phase. We would want them to have training on the CPIMS, is that often in the design of forms and in the design of response, if there is somebody there that knows how the CPIMS works, they can use that knowledge to feed into those discussions on the design of the program and on the design of what the emergency is, what the response is going to look like, because they'll know then how the CPIMS will be designed in relation to the program that's being designed. And really it's using that information as part of the discussion or to feed into part of the discussion to improve the kind of the information management aspects and data collection aspects of the first phase emergency response. So, for example, somebody that knows how the CPIMS works, how information needs to be, how to define what information needs to be collected and used and shared, will be in a better position to support the country to the response, to define, for example, and design the form that's collected to register children, for example. So having that background knowledge, I think, would be useful as part of the discussion in the design of the program.
Okay.
It's Joanna here. If I could ask another question.
Yeah.
You'd mentioned a best case or a case study about the girl who's facing early marriage.
Mm-hmm.
I'm wondering if you have anything you could share with us. You could mention now, but maybe share with us hard copy or a link of some good case studies that we could use, again, to pique people's interest, or if people have a question, you know, if we present a little bit on it in one of our various sessions, and they wanted to know how more it was used. So if there's something about, you know, setting it up prior to an emergency, how it might be being used in a development setting or a mixed setting, how it might be used, as you say, against something like early marriage and not just in situations of separation. Do you have any of those already written up that we could be using?
Yeah, we have some, and I can certainly share those with you. But also we can develop more. That, I mean, it'd be great to hear what people might be, you know, what I mean, I think what people might be interested in learning about. I mean, if it's specifically, for example, a case study on like the two I mentioned, or there's a few others that look at the specific use of how the data that was collected, you know, fed back into the program. I think that those are the kind of case studies we have for the moment. But I'm happy to kind of collect, you know, case studies on how the implementation of the CPIMS went in certain contexts. For example, in Haiti, which was a multi-agency response, and so kind of collecting that and using that as a kind of what to do and what not to do in cases, and using that maybe as part of the training on a response. Yes, I'm happy to do those.
That would be really interesting if you can share with us how this would actually work in other settings. We here in the Jordan country office, we are actually implementing right now quite large child labor program, and I'm in the midst of assessing the case management system that one of our local partners has, and I'm quite interested to see if the CP MIS would be a good substitute for the current the case management system, which is really inadequate at the moment. So that would be really, to get as much information on how we can use it in other settings. That would be really useful.
Yep, definitely. Yeah, we can write some of that up. I mean, it has been used. There are a few cases where it has been used for children with children in institutions, vulnerable children, which is completely aside from FTR or camp settings and stuff. And so I can certainly share that information with you. There are a couple of countries that have kind of contacted us and want to use a CPIMS specifically for child labor programs. So I can also certainly share that information as well. Yeah.
Great, thanks.
Hi, Annalisa. This is Jessica. Can you hear me?
Yes.
Yeah, I had kind of two questions. One, just generally, I know there were about, I think, 13 countries before when I was kind of working on this that were using the database. So just curious to see if that increased over the past year or how many. And then the other question I have is, I know it's generally used to kind of focus on individual kind of case studies, or not case studies, but case management. But I'm curious about countries that really don't have kind of a social worker kind of set up or anything in terms of being able to really manage this type of management of child protection cases, but where they really rely on community-based kind of approaches, and how the database could be used in really looking at that versus individuals, or if that's even possible.
So just in answering your first question, there are a couple of new countries that have started using the CPIMS. Liberia is one. Cote d'Ivoire hopefully will start using it relatively soon. And a few countries that have kind of moved on from using it in emergency response to kind of broadening out the use of the CPIMS to other types of child protection issues. I mean, the CPIMS is a case management tool, so there's no point in collecting the type of data that is required for the CPIMS to be used as a case management tool to be collected if it's not going to be used. For example, for a case management program, you need to collect identifying information on each individual in order to provide them with a case management and direct support, and that's the type of information that the CPIMS uses. I mean, I don't really know whether there's any point in really adapting something really as sophisticated to a certain extent and complicated as the CPIMS to what seems, from your, if I understand correctly, what seems to be more kind of collecting data on or collecting information on issues rather than on individual children's cases. It just seems the CPIMS requires quite a lot of investment, time and money, especially at the beginning to get it up and running, but also, as far as the regular kind of entering of the data and stuff. And also, so I don't really know whether there's any point in using the CPIMS to collect that type of information, or whether it's actually more useful to either use an Excel sheet or use something a lot simpler than the CPIMS. But I'm not sure if I understand your question correctly. Maybe I've understood it wrong.
No, it's pretty much the same. I just was curious because there are many countries that, they really don't have social workers to do follow-up, or the idea of a social worker is, something very new, and so they don't have the capacity on the ground to do individual kind of case management. So just curious, and a lot of them then have more of a community-based response for child protection issues. So that's kind of what I was just curious about, was, if you're going into a country that really doesn't have that type of capacity, how could you really use the database if you don't really have the support, I guess. So I was just looking at if there was a way to use it in terms of community-based approaches as well, to manage, individual cases, but through a community-based approach. So that's all. But I know the limitations of it. I know it's specifically for, individuals and case management. But I was just trying to think if there was a way to adapt it to a community-based as well.
I mean, I suppose, you know, if there are still individual children that require case management, and it's just the who does the case management and who does the follow-up and support, then yes, I mean, it could be adapted to that. You know, there's an argument of saying, you know, does the community have a capacity to provide certain psychosocial services to users, or and I mean, I think it's more from a kind of programmatic child protection point of view than from a CPIMS point of view of whether that's feasible. So yes, I mean, it can, you know, the database or the CPIMS doesn't require to have a social worker. It's not like a social worker needs to be registered to provide the kind of follow-up. I think it's more from a programmatic level that we need to look at that. So I think if there is individual cases that require follow-up, I think it's, yeah, those can certainly be entered into the database and managed by the database. But yeah, I think maybe one thing to mention is that we are seeing how the CPIMS can be adapted to and used by governments, and how so what is given that in a lot of countries where it has been used to date, and where, you know, the potential of using it with the government, let's say the structure of, you know, the availability of social workers, the capacity of social workers is still relatively new and limited. We are looking at how the CPIMS can be adapted to that type of context, and what are the kind of things that need to be taken into consideration. But again, I think there's a fine line between the discussion from a child protection program point of view and the CPIMS point of view. As in, the CPIMS can be simplified to have only 2 questions on the form, and that's all that's asked. And so it's not. I think it's a little bit in line with what Sylvie was saying. I think the discussion, first of all, needs to be had from a programmatic level, and then the CPIMS can be adapted to that. It can be simplified to what the capacity on the ground is from a response point of view, what the availability of services might be, etc. But I think there's a need to define the child protection program first before, or together with the CPIMS, but certainly from a child protection point of view, that discussion needs to be had first. Yeah.
Hi, I wanted to pick up on that. I'm really glad you mentioned the issue of government, and I was also thinking about it when Sylvie was speaking about the brainstorming and the opportunity for advocacy about what are appropriate systems. And there have been instances where governments have created a type of child protection management system that seems more to serve questions of accountability and funding accountability than accountability to children. And I'm wondering whether that page you had about looking at opportunities for complementarity or working together with the others like the GDBIMS or the MRM could also mention something about government databases, because I think there are opportunities to present the CPIMS as a tool for government, but there might be other opportunities where it would be complementary. And it's something that, for myself, would require some more brainstorming, depending on the context and all of the issues that people raised earlier about case studies. Is it a conflict context? Is it a development context? And that's a really interesting area, I think, to look at this tool and how it can be used.
Yeah, absolutely. I mean, I think definitely we are working with countries to see how it can also be work with government systems. I think where the government already has a system in place, you know, looking at the compatibility between the CPIMS that might be used by agencies and the system that's used by a government would certainly be interesting. In most cases that we've supported, in most countries that we've supported so far, the CPIMS is being used and being introduced to a government that didn't have a system. So the CPIMS has been used as a kind of basis or platform from which to customize and design the child protection system that would be used by the government. So yeah, I mean, I think that both would be interesting. I think from our level, what we're looking at is the compatibility from a kind of, I mean, I think, you know, in countries where the GBB IMS is being used and the MRM is being used, we're looking at what the programmatic compatibility might be, and in which cases the systems would need to share information and how. And then once that's defined, I think we could look at the technological aspect. I think with government, it needs to be defined on a country-by-country basis, because each government is developing their own, or may have already their own system. So we're certainly, you know, if a country program comes to us and says the government is using this, we've been using the CP IMS, can you work with us to bring the two together? We're happy to do that. This has never arisen in any of the countries that we've supported so far. But that certainly would be a very interesting angle to also look at, definitely.
Great, thanks.
Is there a last question, because we're coming close to our hour point?
Just one very technical and maybe not very relevant, but it's just about the flexibility of the database system. Is it something that once you've decided on the design, is easy to change because you identify new needs of information and things like that?
What we try to encourage, the only thing that can't be changed, or that it makes it more complicated to change once it's been defined, is the registration form. So what we encourage in programs that know they will change over time is to keep the registration form as simple as possible. Try to have as few questions as possible in the registration form, which would be generic to all children that might be registered, and then have as many subsequent forms as possible, and subsequent forms, follow-up forms, can be added, changed throughout the life of the CPIMS, as it were, and the program. The registration form is more complicated because once it's defined, it can't be changed, because then all the children that were registered beforehand won't have any of those fields already collected, and the registration form can't. And therefore it's more complicated to change it. It is possible, but it's complicated and a bit expensive. An example is, for example, in Haiti, where it was used for FTR, for the earthquake emergency response. The registration form that was designed was specifically an FTR for the earthquake. So there were questions related to the earthquake, etc. What's happening now is that they want to start using the CPIMS for children that are in institutions across the country, but not all these children. The questions related to the earthquake aren't really relevant anymore. So what we're actually now having to do with the Haiti program is design a pre-registration form, which will become, once it's done, the registration form, which literally has just 5 fields: name, surname, address, and age, etc., and sex, for example. And that will become the pre-registration form, and then there'll be the registration form earthquake and registration form non-earthquake. And that's what made it a bit complicated. So, but otherwise, yes, it can be modified as the time goes by, definitely.
Okay, thank you.
Okay, if I could wrap up the call here. I wanted, obviously, first of all, to thank Annalisa for preparing for this and spending the hour with us. Annalisa, am I right that I'll be able to get those PowerPoint slides as one presentation and then circulate it to everybody?
Yeah, I can send them to you straight away. Yeah.
Lovely. So everybody who's on the call, I have your email, and I will forward on then the PowerPoint presentation, as well as this session itself has been recorded, and we will let you know how to access it online as well as our colleagues. I wanted to thank Aliocha as well for helping us in this first attempt with WebEx, and we'll be doing a debrief later to figure out how to take it forward. So if any of you have some feedback, then please feel free to call me or to drop me an email to let us know what you thought and what improvements we might be able to make. I wanted to thank all of you for taking your time in the morning, afternoon, or evening for joining with us. And then just to remind you that our next session is Tuesday, February 7th at the same time. Katie Barnett will be joining us to talk about coordination. And on this issue, there is actually a module for trainers in the face-to-face package that UNICEF had developed coming out of the CD-ROM, the Introduction to Child Protection and Emergency CD-ROM. Now, the new version of that hasn't been released to me yet, the new version of the face-to-face training, but hopefully it will come in the next week or so, and therefore if you do sign up, if you do contact me saying that you're interested in the February 7th coordination session, I will have the module to send to you that you can peruse before our discussion with Katie Barnett. Okay, unless there's anything pressing, I will again thank everyone for joining us and hope to see you on February 7th.